When I took those 3HP, I realized the importance of 3HP, that prevention is better than cure. So I went home, I started to educate my family. 3 of my daughters, they are on HIV treatment. So also they took 3HP. TB is easily affecting those people who are taking HIV tablets. So if they prevent, it will be better for them. Because if they ignore that, then TB is easier for them to be affected.
About 1/4 of the world's population has latent TB, and left untreated, tuberculosis infection may progress to active disease. Preventive treatments lower the risk of progression in people at risk, while curable and preventable, TB still kills 4,000 people every day, among them 700 children, which is unacceptable. At Unitaid, we consider that investing in preventive therapy is key to progress towards ending tuberculosis.
Unitaid's investments in the IMPAACT4TB project, led by the Aurum Institute, it enables us to catalyse the scale-up of 3HP in 12 high-burden countries, with the aim of further catalysing scale-up of 3HP globally. HP addresses some of the barriers to scaling up the Eisenhower preventive therapy, and its benefits are that it's shorter, it's 3 months instead of 6 months. It's only the 12 doses versus 180 doses. It's better in terms of its safety profile. More people complete the treatment, and it has similar efficacy to the Eisenhower preventive therapy.
For over 15 years, Unitaid has led the way by identifying game-changing health innovation and making them a reality in our target markets. By clearing significant access barriers, Unitaid has been able to work with our partners to make access a reality.
As a first step, Unitaid and IMPAACT4TB focused on establishing the efficacy, safety, cost-effectiveness, and optimal delivery evidence which enabled 3HP use in key populations, including people living with HIV and children under 5 years who are household contacts of TB patients. There is lack of evidence on dosing, safety, and tolerability in other populations, including infants, children, and adolescents, and pregnant women living with HIV. Unitaid continues to fund the IMPAACT4TB Consortium to generate more evidence for even shorter regimens in these overlooked populations.
When introducing an innovation, Unitaid ensures that significant access commitments are secured for the target markets. These include ensuring that we get the right price, significant quantities at the right quality of the product, and the product is registered in as many countries as we need them to be registered. A landmark price agreement has been reached with these manufacturers that has led the price to reduce from $72 to $15. This has been made possible only through the partnership with our other development partners like the Global Fund, PEPFAR, USAID, and GDF, the Stop TB Partnership.
The initial capacity was about 180,000 patient courses per year. That has grown to over 4 million patient course capacity across the 3 manufacturers. So we have the innovator Sanofi, McLeod, and Lupin, and they added to the additional capacity and additional formulations.
Sanofi had brought the necessary volumes, and it brought the sustainability of this bigger, wider market for this shorter regimen. Very quickly later, generic companies followed in our footsteps as expected and brought the necessary additional volume. So the support of Unitaid, we managed to get there in a matter of months instead of years, and so bring this shortened treatment course to millions of patients much quicker than if we were going it alone.
Right at the beginning, we combined medicines that were available in different pills and made it into a fixed dose combination so that patient could have a better compliance. Unitaid, along with Clinton Foundation Chai, got involved in a lot of market shaping activities in order to build the capacity for serving the number of treatments that they were looking for.
Fight vector prevention of tuberculosis is an excellent example of what good, strong, bold, balanced partnerships can achieve. So this is something that keeps us inspired in all the projects that we are driving currently.
IMPAACT4TB has provided funding to community-based organizations and partners to conduct demand generation work for short-course rifapentine-based TB preventive treatment at the local, national, and global levels. These investments in communities have helped to ground Unitaid's work in the lived realities that people face, the priorities that they weigh when they consider whether to take TB preventive treatment or not. Working with community and civil society partners has helped to expand awareness and demand for 3HP and 1HP. In 2018, really only one country had access to 3HP. By 2022, 138 countries now have access to 3HP and 1HP, more affordable pricing. The ground has been prepared for partners like Global Fund, PEPFAR, and other donors to take these interventions and bring them to scale. And this wouldn't have happened if Unitaid and IMPAACT4TB hadn't seen community as a central piece of demand creation.
At PEPFAR, we believe everything is possible, but only in partnership. Unitaid's investments were pivotal in demonstrating the feasibility of 3HP implementation in PEPFAR and Global Fund supported countries, and in helping build the market to make 3HP more affordable and accessible to the clients we serve. Through their support of Orem Institute, Unitaid also paved the way for 3HP implementation and helped build the evidence base to avoid drug-to-drug interactions as we scale up 3HP.
And the relationship between the Global Fund, Unitaid, and other partners continues to be vital in ensuring equitable access to innovation and accelerated health product introduction and scale. Unitaid's work with research and development partners and industry to bring products to market, and the Global Fund's ability to provide scale and reach are a strong collaboration alongside others in this important ecosystem.
Civil society that are in the space of fight against TB have a big role, which is advocacy, by creating awareness and ensuring that there is increased demand for our communities to come up and demand for this TPT. For the government, it is very key to ensure that there is enough supply of TPT in our facilities. Donors are very key because they need to provide more allocation to TB prevention therapy for our people in the community.
Unitaid's ability to make a difference lies in its expertise in market interventions to overcome supply and demand barriers. We've established sustainable supply chain processes to make sure that delivery of the products to in high TB burden countries are happening.
In the history of the Orem Institute, we have found that Unitaid's model is indeed unique and addresses a critical gap in the global health response. Unitaid's investment in an organization of the Global South has transformed a South African organization into a global player. For its part, Orem enhanced Unitaid's awareness of the TB landscape and advised on evidence gaps and country needs.
Equity, partnerships, and community engagement are key to Unitaid's continuing success. We will continue to advance the cause of equitable access to game-changing health products and accelerate progress in global health to transform lives, make communities more resilient, and help humanity care for the most vulnerable amongst us.